All right. Welcome, everyone, and good afternoon. This is Colleen Murphy. I am HPSM's Network and Strategy Officer and joined by some wonderful folks from our team today. Want to just really thank folks for making some time this afternoon to join us. We are hoping to use this hour with you to really just talk through some strategies for managing increased behavioral health demand, which we know is a challenge that our community here, as well as the entire country, is currently facing. I will hand it over to our host for today, and we'll walk through some of those strategies before opening up today's meeting for some live discussion as well. So we can jump to our next slide here, and I'd like to introduce Amy Scribner, our Director of Behavioral Health. And Amy comes to us with a fantastic background as a provider and really someone that folks here on this call may have met before, but working closely with many of our community partners for some time here in San Mateo County. We will also be joined by Courtney, and I'll let Amy say a few words about Courtney as well. But Amy, I will hand it over to you.
Great, thanks, Colleen. And so I'll be starting us off today, and then we'll turn it over to Courtney. And Courtney is our Manager of Integrated Behavioral Health. She has a wealth of information and knowledge in mental health and case management within the county, skilled nursing, and then has worked at HPSM doing both utilization review and care management. So we will jump right in. And just to kind of agenda set, we will have a time at the end for discussion and questions, so please do hold those throughout. Perfect, thank you, Julie. Oh, yep, you can turn it. Thank you. Great, so why are we here today? So we are here because nationwide and industry-wide, we're seeing increases in need for behavioral health. So as people know, COVID-19 and its adjoining challenges have stressed individual providers and systems. Clinical practices are full and unable to take new members. In San Mateo County, we are experiencing a significant demand for mild to moderate behavioral health services amongst our members. So we would love to enlist your support in helping manage this demand and practice at the top of your license. Our wait list of HPSM members who are motivated for treatment and waiting to be matched with a behavioral health provider is significant, and it continues to increase on a daily basis. As you can see from the data on the CDC website that is linked here, there's a higher incidence. Increases are largest amongst adults ages 18 to 29 and those with less than a high school education. So with the behavioral health demand on the rise nationwide, many providers report it's difficult to accept new patients. Go on to the next slide. Perfect, thank you. So our call to action today. We have over 200 members who are waiting to be matched with therapists. Wait times right now, especially for therapy, can be up to 6 weeks. An average of 75 members per week are requesting mild to moderate mental health treatment, and 75% of all referrals are initiated by the member themselves or a family member. People are interested in receiving mental health care and are reaching out for help. Early intervention and treatment may prevent some members from hospitalization or going to a higher level of care. So if you want to switch to the next slide, great. So today we're going to be talking about a number of strategies where you can really help in meeting this need. Then we're going to talk about next steps and discussion. I think the chat is open, so as things come up, if you do want to ask a question, feel free to pop that in the chat, and Colleen and Julian will be monitoring that. So now I'm going to turn it over to Courtney to start talking about some of these strategies for how you can help serve our members.
Thank you, Amy. So I just really want to thank all of you for taking the time to be here with us today. Julian, I'm going to ask you to go back to that last agenda slide briefly, just because I want to set our course. So Amy kind of gave us our challenge and our call to action, and we're going to walk through some strategies together. So the first three on the agenda are some strategies to help manage increased demand and make sure people in our community can receive the services they need without long wait times. Along with this agenda, I have a couple main goals for today that I hope you can attune to as we move through this time together. We hope to share some ideas, resources, and including specific practice strategies and local partners, but we also want to hear from you about best practices and challenges in managing this increased demand. So please be ready to participate later and hold any questions for this section later in the hour. All right, next slide, Julian. So as we showed in our call to action, both nationally and locally, demand has steeply increased, but the number of providers we have, both nationally and locally, can't increase overnight to resolve this. So an imperative for HPSM and our providers and community is to become very effective at triaging to ensure that those with the highest needs can receive services and prioritizing access for those most at risk. A critical component to allow us to do this is making sure that your clients, or as we refer to them, members, are receiving the right level of care for the appropriate amount of time. If a member no longer has an active mental health condition, or if their treatment is no longer making a meaningful impact for their symptoms, and they require a higher or lower level of care, it's critical to transition them to the appropriate treatment so that our many members who need services can get into an appointment. That's where this image of a bottleneck or kind of a gridlock is really relevant. So one member receiving non-medically necessary services for an extended period of time could be holding up access for someone else who really needs care. So ensuring that appointments are used for medically necessary services is always important, but it's even more important now in our current environment of increased need. So with that in mind, I want to make sure that we have a chance to spend some time talking about what medical necessity really means. So I'm confident that all of you are familiar with that term, medical necessity, but did want to spend a little bit of time focusing on what that means for the benefit that HPSM manages and that you provide as our contracted providers. The benefit we provide is a mild to moderate mental health services, and the medical necessity definition here is fairly simple. So medical necessity is healthcare services or supplies needed to diagnose or treat an illness, injury, condition, disease, or its symptoms that meet accepted standards of medicine. So essentially, it means treatment needs to be appropriate for needed for diagnosis and treatment of an active mental health condition that is causing mild to moderate dysfunction. Treatment needs to be expected to either improve symptoms or prevent symptoms and functioning from worsening. And thirdly, the member must be willing to participate and be sufficiently able to engage in the care plan interventions. So I will call out that under Medi-Cal, youth under 21 do have some expanded criteria that include risk factors and prevention. So I hope you'll attune to that if you are serving that age group. But essentially, medical necessity means that a member needs to have a treatable mental health condition that your services can truly impact. So by ensuring this is always the case, you'll be able to prioritize members that with the highest needs. So I also want to have you keep in mind that some of you may have a caseload of private pay clients as well, where insurance coverage or benefit criteria are not involved. So there may be differences in how you choose to manage those clients, but we do know that appointment availability is impacted by your entire patient panel. So we hope you'll keep this top of mind, especially for our HPSM members. So once you've determined through your initial assessment that treatment is medically necessary, you'll be providing care that will include ongoing assessment and treatment planning, and adjusting and updating care plan goals and interventions regularly as members progress is really a valuable and imperative part of their care. So I'm going to tune to just a couple examples of ways that you can really maximize this effort. So SMART goals are an especially useful tool for ensuring that you can prioritize highest need members. So I think you guys all have heard of SMART goals before, but it doesn't hurt to remind us of the acronym. But this is specific, measurable, attainable, relevant, and time-based. So by setting goals in this way with your clients, you lay out a clear path for recovery. This goal setting model is critical for accountability of both patient and provider and serves as a reminder to check in on progress and update goals and approach periodically. Also, client-centered treatment plans are really another useful tool for ensuring that you can prioritize highest needs members. By focusing on client-centered treatment plans, you can ensure that you're able to operate at the top of your license and use appointments for those at highest risk. There are many evidence-based treatments that are brief and effective in impacting symptoms. CBT, problem-solving therapy, DBT, and others can be utilized. And for many, short-term and targeted interventions may improve symptoms rapidly, and clients can return to some of their natural support systems and the care of their PCP within a few months. Or you may determine that a member will benefit from treatment 1 to 2 times a month instead of weekly. This may be based on their ability to engage in treatment plan. It could be part of a tapering off of treatment towards independence, or it may be due to the member's scheduling needs. All of these might be appropriate ways to ensure the treatment plan is client-centered. Each of these steps helps ensure that your practice has the ability to continue to open to new intakes for those members that have emerging needs that may benefit greatly from early and brief intervention. So one tip we wanted to call out is some members may need longer-term treatment to mitigate their symptoms. And if a member is in treatment for a year or 2 years with no change in diagnosis or symptoms, it may be time to consider if this member might be in need of some more intensive services or other social or community supports. So remember that reviewing medical necessity reminds us that if a member's symptoms are not being improved or prevented from worsening, the treatment may no longer meet medical necessity and may really not be meeting their needs. And so a new treatment pathway may need to be considered. So as you are ready to transition people out of your practice and or you have new availability, we don't need to be informed when you have completed care with a member, but we do want to know if you have new openings for additional members. Please email us and call us to alert us of any updates in your availability. And one reminder, if you're part of an agency, there should really be one person contacting and updating us. So I've talked a little bit about how to prioritize highest needs members by attuning to medical necessity and care plans. And now I'll talk a little bit about how to engage other providers and partners for both support and discharge planning. So one of the first strategies we want to encourage is engaging with a member's primary care provider. We recommend that you connect with PCPs early on in your treatment. Early on in your treatment process. There may not be a significant need for coordination, but it's always a best practice for treatment team members to be aware of each other. The member's assigned PCP can be identified in the HPSM provider portal. And the PCPs may be able to provide some basic mental health support and health education information that supports members as you provide care as well. So they can also be a critical partner in discharge planning. And I really want to emphasize that the end of mental health treatment is not the end of care for our members. Every member will have a unique set of needs that with your services will be met with a clear treatment plan and a clear discharge plan that can include some of these supports that I'll continue to talk about. So if a member no longer meets medical necessity and it's because they need a higher level of care or specialty mental health services, then you'll need to work with Behavioral Health and Recovery Services Access Call Center team to ensure that the member is screened and connected to an appointment with one of the county clinics before ending your care. So we've put a screenshot of the form here. It's available on our provider forms page. It's been newly posted there. But for those of you who have worked with BHRS in the past, the form should be fairly familiar. It reviews clinical information and status that would qualify a member for specialty mental health services, or as sometimes it's referred to, a higher level of care and those services are managed by Behavioral Health and Recovery Services and accessed through filling out this form and faxing it over to the Access Call Center for their screening process. So another support option, both for adjunct and also discharge planning support, is you can activate Health Plan of San Mateo. You can refer members to our coordination or care management team. We've put a link on this slide and a little screenshot of our website for our care coordination program. Some examples of appropriate referrals might be, you're working with a member who is progressing in therapy, but really just struggling with managing a medical issue, and you think they may need some more support in following up on medical care. It may be a client where you just can't quite figure out what the missing piece is, but something is preventing them from progressing in their wellness goals. So upon receiving the referral, our teams will review the requests, we can assess medical claims and history, and help identify what supports a member may qualify for within the benefit, or just simply help encourage and follow up on needed treatment and recommended care. So it's really important that you keep in mind that this is an entirely voluntary program. So if you are considering referring a member, please discuss it with them first so that they know that you want them to get more support. And that may be the most important thing. So these may be familiar numbers to you, but this is just a reminder that there are community groups and resources that members can access both in person and online. These are just a few that may be useful as an adjunct to your treatment plan or as part of your discharge plan for a member. And I also hope that some of you are thinking of additional resources that you like to use that you can maybe jot down and share with us a little later in the discussion. So we've talked about some strategies to prioritize our highest needs members. We've talked about engaging providers and partners for support and discharge planning. And now I'm just going to talk really briefly about considering offering groups to support our members. So one very simple way to address our increased demand is by considering offering group services so that more members may be served by the same amount of providers. So I wonder if any of you have considered starting a group. Maybe you have several patients that are managing their depression or anxiety well and nearly ready to transition to independence, but would really benefit from social support and connection of a group. You may want to consider offering a short-term psychoeducational group, self-management group, or maintenance covering topics around managing depression or anxiety. And also, this is another moment where I'm going to hope maybe some of you have a couple ideas in your back pocket that you might be considering that we'd love to hear about later in our discussion. So now we're just going to review some next steps before we move on to the discussion section. So I've said it a few times, but really want to kind of call these out and have a visual for you of thinking about these three different strategies for your practice, treatment planning, and discharge planning as you work with our members. So prioritizing our highest needs individuals, ensuring that treatment meets medical necessity and that the member is receiving the right care for the right amount of time. Also focusing on member-centered treatment planning by using SMART goals, evidence-based short-term treatment. Also, just a reminder of, as you move through care planning and also discharge planning, which we know starts at the very beginning of care, being sure that you're engaging primary care providers, utilizing that higher level of care for specialty mental health services form, utilizing our care coordination, care management team here at HPSM, and considering if any community support groups or resources may be useful for a patient that you're working with. Really want to call out the Cal Hope Warm Line. It's a resource that is kind of born of COVID-related needs and is a very accessible resource to support our community at large, and hope you all are aware of it. So just one more reminder, consider if you're ready to start a group. This could be an excellent strategy for us to work together to meet the needs of our community. So those are our net charge for our next steps. And I think I'm going to hand it off. So thank you.
Great. Well, thank you so much, Courtney and Amy. We have a couple of questions that we're hoping to get folks' thoughts on this afternoon. But before we jump into that, we actually have some really great questions here from the audience. I'm going to take the easiest of those first, which is a question that came in about whether a version of these materials will be shared. And yes, absolutely, we'll be sharing both the materials as well as the recording. But there were also some questions that came in here that I would love to hand over for a little bit of discussion with our team. So one that I'll just read out here to the group, and we'll also publish this in the chat, is that my program is contracted for both mild to moderate services with the health plan of San Mateo, as well as specialty mental health care services with behavioral health and recovery services. So the question here is, do we still need to use the Activate Specialty Mental Health when the client ends up staying on the original clinician's caseload? So I'll go ahead and publish that in the chat, and then want to actually hand that one over, Amy and or Courtney, if you wanted to share some thoughts on that one.
Hi, I decided to turn my camera on for this part. Hi, everybody. I think that there's a handful of providers that are in the unique position of offering both levels of care, and I'm gonna encourage you to communicate very clearly with BHRS around what they want you to do under your contract process and what their expectations are of you for your services under specialty mental health. I think you're going to our recommendation is to follow this process we have laid out. If you are serving a mild to moderate member and their level of care needs change and you believe they need specialty mental health services, I would still fill out this form.
That's great. Thank you. Thank you, Courtney. We have another one that also just came through here on whether if clinicians refer a member and ends up not being able to take them on, can we refer them back to HPSM?
The short answer is yes, and yet I would want to ask some follow-up questions. Is there a reason that you weren't able to take them on? Was there a miscommunication about your availability? Are they somebody that you're worried you can't meet their specific set of needs? I ask those questions because we do get that from time to time when a provider receives a referral, they get started with the member and they think, oh, I think this member needs something a little bit different. And really want to encourage each of you to think about, is that little bit different? Does that exist? You know, I've had a few requests for some really specific types of treatment that we may or may not, like not just types of treatment, but, you know, layers of matching that may or may not exist. And by layers of matching, I mean people can have a preference for culture or gender or location or treatment modality, and those may not all come in the same package. They may not all come in the same provider. So if you are not able to see a member, you can refer them back to our team, but I would ask you to really consider if there are ways that you can meet the needs of the members that are referred to you. But yeah, the short answer is yes, and with a few follow-up curiosities.
Yeah, and to those follow-up curiosity points there, I don't know if our original asker of that question has additional thoughts on that and wants to jump in. I'm not sure that we have our voice chat enabled for this, but we are monitoring the chat there if you're able to share any more on that challenge. There's a couple of other questions here, including some with some more specific questions around some operational challenges and for some suggestions to those, as well as on some billing questions. And so I want to just be mindful of our time, and we'll try to circle back on some of those with both a short answer as well as some follow-ups for outside of this forum today. But actually, one of those questions that did come through again before we jump back into this Q&A here is around what the services that the care coordination team here with HPSM would provide to a client. It's a great question. I know we've teased the complex case referral process previously, but just maybe if I could turn that over to Amy and Courtney to say a little bit more about what care coordination consists of.
Sorry about that. It can really be a range of supports, and we hope to meet needs for where members are. Some folks may need lots of reminders to make it to medical appointments. Some folks may need lots of support to coordinate complex care like medications, dialysis, specialty care from specialists, and sometimes coordinating that care, keeping track of all the elements, making sure different providers are communicating can be very complicated. So it really does depend a bit on what the member might need. But one of the things that we try to help do is we try to be knowledgeable of the variety of services available to our members in the community and by other services that they qualify for. So there are some case management programs available through Aging and Adult Services. There are some case management programs through Golden Gate Regional Center. And then some special programs that we're partnering with that people may qualify for, and we try to route them to those also. So it can really be a range of services and supports. But I will say this, it's really, I said it in the part where I described it a bit, it really is very critical that the member be interested in this type of support. So I always like to think about the question of like, who helps you with your care? Are you doing this all on your own and things are slipping through the cracks? Or do you have a family member or a neighbor or somebody? And if somebody is like, nope, it's just me, I've got no support, I think those might be good folks to refer over to us, but they really have to be interested in picking up our phone calls and ready to work with us about, on some of the strategies to meet their health and wellness goals. And if I left anything out, please add it, folks. Amy or Pauline.
No, Courtney, I think really helpful. Unless Amy, there's anything you wanted to add to that as well.
No, I think Courtney got it all.
Great. Well, I'm also realizing as we're walking through some of these questions, it looks like we are not, unfortunately, able to unmute folks for you to ask those questions by voice. So I apologize, we're a little limited to chat here. But with the time we have, I do want to just touch on some of those questions and really encourage folks, if you are able to type those into the chat, to share some thoughts on these. And I will circle back on a couple of the more specific comments that have already come in through the Q&A there. But just, again, thinking a little bit about how you're managing to keep up with increased behavioral health demand. Really curious to hear if any of these strategies that are listed here are ones that your practice is already using, or if there are other strategies that you've been using just to really kind of meet the demands of the moment, and work through increased demand for your practice. So I'll give folks a moment there, but would love to hear any thoughts that folks have on this one here in the chat. I'll tie that in with the second question here, which is really what those more particular strategies are for successfully transitioning patients to the right level of care. Whether that is using community resources or specific tips that you have for actually having those conversations with clients or members, as we refer to them. And then, I would love to hear from folks, whether that is today in the chat or in follow-up to this, if any of the strategies we've talked through today are ones that you'll take away and would like to try to implement, or if there are ones that you have further questions on, including the areas around community resources to leverage. That is an area where we're continuing to build out our own resources to make that information available. We know that can be often tricky to navigate all of that information about who's really out there and who can one work with. And so that is information that we're working to really try to centralize on our website. So again, I want to encourage folks to add any comments to the chat on those questions. I think we've got a couple of other comments though here too that I do want to circle back from the chat. A couple of these are some known challenges, I think less so specific to increased behavioral health demand, and really just some operational challenges of working with a new payer, with our newer relationship between HPSM and you all. We've been kind of working through some of those topics, and one of them is actually just around the electronic tools that we use. So I want to thank the participant who added some really thoughtful comments there about some of those existing challenges with using online tools and just with checking member eligibility. I'll share kind of a couple of things at a high level that we are constantly having internal conversations around and trying to really plan around. One of them is just a kind of the fact of Medi-Cal eligibility is that we do have folks who tend to cycle on and off of being eligible pretty frequently. And, as I think one commenter called out here, that can be a real challenge when eligibility is not active, but you're still providing care. I do want to invite either Amy or Courtney to weigh in on some of the resources that may be available if a member does lose eligibility but is still low income or has other qualifying factors that might make them available, to make some supports available for them. So I'll invite some thoughts on that if folks have them, but just did want to kind of loop back on the eligibility question and how to check that. This may or may not answer kind of the concern, but we have recently published some short videos online about using some of those online tools. We know that there are multiple logins there, but there is in fact a short video on how to check member eligibility. And so if that is an area of interest for you or not one that you're familiar with today, if you could please leave your contact information in the chat here, we can follow up with those resources as well as with additional training and Q&A for your team if that would be helpful. I think the other component just on the online tools, so we're really working again with kind of this being a newer area of working with you all for us in the plan. We're really trying to build out those online resources for you and for your teams. And we kind of a few priorities there. One on trying to consolidate some of those tools that we have today. There are different tools for different functions. The other is we're always working with our vendors to try to make some tweaks to those tools to make them more usable. So there are some recent changes to our provider portal on some of the functions around being able to see prior authorizations, less relevant for many providers, but when prior authorization is required, we've made some tweaks to what information you can see in the online portal. And we're constantly looking for kind of specific feedback on those components of the portal that folks would like to work on. All right, I will loop back into kind of that question that we teed up though earlier, and perhaps somewhat related to this kind of managing increased demand, and just because of the administrative work associated with it. But any just first, thoughts on that one in your, Courtney, or we can also follow up on this around changes in coverage and when a member is under treatment, but then their eligibility changes mid-course of treatment.
Yeah, I think that is a challenge. And Colleen, I'll ask for your support in talking about this, but if there is no eligibility, we can't pay for the services, right? If they're not our member, we don't really have a pathway for us to pay for it. That being said, there are sliding scale community clinics available throughout San Mateo County, and we may want to provide, we may want to kind of look those up together and make sure folks know what those are. But I hope that some of you may be aware. Some of the agencies we work with may also offer sliding scale services to uninsured folks. We all know that mental health and issues and treatment needs do not know the bounds of insurance coverage, and so there are those resources available. And I think each individual provider has to be sure that they're checking eligibility so that they know that payment is available through HPSM, or if they need to consider what other options they have to work with this member.
Mm-hmm.
It's an imperfect answer, but there are community resources for sliding scale services.
Yeah, and I'll just emphasize Courtney's response on that one. Again, that is part of a challenge of working with Medicaid. I wish I could say that we were unique in that, but do want to also recommend learning a little bit more about some of those sliding scale resources for cases where there is that lapse. And then, the other really just kind of call to action, I think, it is to continue to share that that feedback on the real-time nature and usability of those eligibility checking tools online. We are unfortunately constrained to the quality of the data that we get from the state on all of that. So I will certainly say that we are in it with you in terms of that challenge, that it is a constant focus for any Medicaid plan to be managing those eligibility changes, but do want to really encourage you to continue to share that feedback on ways that we can make those tools better and more usable, so that there is less of an administrative burden on your practice. Great, and I'm just seeing a few comments here come in terms of just some emphasis on that. Some of that continued training on the portal would be of use. So we will certainly take that as a follow-up from today and point folks to some newer resources that we're developing there as well, to just make that easy. And then I think there were some follow-up questions that we will take back on kind of some of those specifics there. So there were a couple of questions that came in if we didn't get a chance to talk through those live around kind of billing questions and list and the sliding scale services that Courtney mentioned, that we can provide a little bit of written feedback to attendees after today. And then I think we're scanning here again. If just making one last check here in the chat, we again haven't gotten to every single question here today for the large group, but we will be following up with folks who have shared those comments and making sure we can provide some of those resources that we talked about today. And I just want to thank everyone for joining us. I want to thank you for piloting this Teams live event approach. Again, we wish we could really be having this discussion with you all in person in a room together. We are certainly looking forward to the day when that is possible. But really want to thank you for joining us with this trial of this virtual format, and for everyone who provided comments here in the Q&A. And want to thank folks for spending some time with us on this topic. We know that this is really top of mind, I'm sure for you and as well for us as we're trying to make sure that members can, particularly our vulnerable members, can really get through to those services that they need. Thank you everyone for joining today. We will again share the materials from today's presentation with everyone who is registered, and also we will be posting a recording for you to use as of help. Take care, be well, and thank you again.